Hey, everybody. Fascinating chat today at the intersection of AI and genomics and precision health with a true innovator in the field. Dr. Kapoor, how are you?
Not bad. Thank you so much for having me on your show.
Well, thanks for being here. Really intrigued by your work and mission. Before that, maybe introduce yourself, a cardiologist, an entrepreneur, now an AI and genomics innovator. How do I describe you and your work?
Well, you can describe as someone tells me I'm a disruptor. So I do disrupt things for the better of the humanity. So there are things I do as I'm a cardiologist. When I start practicing, I want to improve healthcare outcomes in Alberta, Canada. So I disrupted how the healthcare it was getting delivered, and the changes were implemented, and they got implemented later on. Then I saw there was a gap that exists in genomic space, and we stepped up and provided the knowledge and the research we invested money in, and the time and effort, trying to find a way how we can improve access to healthcare based on genomics. And many people are suffering, and there's a delay of access, and not because of money issue. It is both because people don't have timely reports coming back to them. The doctors, if they don't have the reports, how can they take an action? So a lot of time we are doing one glove fit all approach. It just doesn't work anymore in today's day and age. It could have worked 10 years ago. So I'm very passionate about it as a cardiologist, preventative medicine expert in this area, and also learned about longevity medicine. I want to understand how we can delay the onset of diseases, and how we can truly provide better care to the patients. So that essentially motivated me to found company Bioerero, and we are proud of the team what they have achieved so far in a short period. And I'm super excited about this field for the future.
I share your enthusiasm. So, what was the aha moment that led you to launch BioAero?
Well, the aha moment. So it all started with the COVID. So that would
Mm,
be the story. We were in the COVID times. There were challenges, patients were suffering, and people were suffering. The COVID testing PCR report was taking them 2 days, 3 days to get the report to see if they have a positive or negative COVID. We found a technology, a lab-based old technology, converted it into hybridized into PCR base, and we started getting reports in 30 minutes or so with versus traditional 90 or 90 minutes or 3 hours it was taking for the PCR machines. We understood that the test needs to be delivered in a timely manner, so we invested money into technology, and later we realized that the COVID has many variants. There's a Delta, there's Omicron, there's so many coming up. We start sequencing viruses, understanding the type of virus is mutating right now in around our community or globally. So from there, we realized that sequencing is a huge gap that exists in the human genome, which is much more complex than a single virus genome. We have to analyze it or sequence it. So we got the high performance sequencer machine, and my team did a whole genome sequencing. I was one of the first ones in my company to get it done, along with my family. It took them 3 months to analyze the whole genome. At
mm.
that time, it said, you can't work like this. The medicine cannot be delivered like this. No wonder it is not getting used because taking 2, 3 months to get the report. My own report took 2, 3 months for my team to get it done. So that's
Mm.
where I traveled around the globe. I start understanding how people are doing it. Doesn't matter. I went to USA, Singapore, Middle East, Europe, UK. It doesn't matter where I went. Everywhere the same problem. Report was taking 2 to 3 months. It wasn't just my lab. It is just how the cumbersome the process is, a large amount of data that needs to be analyzed. The clinical report needs to be generated, and manually takes that long time. And that allowed me to figure out there is a market gap that exists. We are still using old technologies to sequence, analyze the data. So we have to find a new way. And AI was coming up around those times. So we invested resources in that area. We understood that we need to harness power of parallel computing and multiple servers same time to be churn out large amount of data in real time. So that's where the innovation started. So essentially, need is a mother of innovation. Essentially, there's a need, and there were solutions possible available. No one had tried them before. We ventured into them, and that became the aha moment.
Brilliant. So, how do you describe what BioAero does to someone maybe outside of the healthcare industry or the tech industry? Like my mother, for example. What would you describe to her?
Well, I'll describe to her that there is a uh, there's a secret key. We all of us are born with it. It has been
Mm,
given by our parents, and there's a blueprint of our life. There is
mm,
a genome, and that code has a transcription of the message that needs to be unlocked. That can tell us a lot about our body and about my family's health and about everyone else around me. So if I
mm,
unlock that, so then I can decide if the treatment they're getting is the right treatment, and if there is something could be coming in the future that could be intercepted, and perhaps they could live healthier longer. And perhaps they get the right treatments, and if there is a history of some cancers, so they could be then deleted out of their code. And if there are some rare diseases in the family, they could be stopped happening in the family. So all of those applications are possible today, and that's what BioAero is doing. So BioAero can help analyze that code that everyone is born with it. And either it could be in the gut microbiome or the skin microbiome or the oral microbiome or the whole genome, and help them understand in a reasonable manner so what that code means to them and to their family and for their kids. And also to see if the medication they're using is the right medications. Many times people get side effects, they take
mm,
unnecessary medications, and they waste their money and time and their health. So rather, they would get to the genomic way, they'll get the right approach the first time without becoming a guinea pig. And they have less side effects and better success rate by taking those medications. And I'm hopeful with this message, your mother will be happy and want to take the next step and want her to get tested and want you to get tested.
Well, it's a wonderful thought. I certainly will take you up on that. So you're covering the full health data stack, as it were, from the genomic sequences to the microbiome testing. Anything else? So what does that mean for not just patients in terms of the preventative capability, but also the payers in our system?
Well, thank you for asking that question. From the payer system, what the system has been built in medicine. Patients have to develop a disease and then
Mm,
or a symptom of the disease, and the doctors will have to be seeing the patient and trying to diagnose the disease. Many times it's a guesswork. We don't have 100% accurate test. There's no test in medicine that is 100% accurate. I can tell you uh, why you have the disease. I haven't come across yet. We always have hypothesis. Yes, it's an inflammation that could be triggering the heart attack, but lipid particles along with other things that play the role. But there's more to the story. We believe there's genetics also plays a role, and also type of diet we eat that also plays a huge role. And we always tell people eat a healthy diet. What is a healthy diet? We tell people eat a Mediterranean diet. Okay, what does a Mediterranean diet means? Can people even afford how they are individually reacting to Mediterranean diet? Maybe perhaps for an Indian person, maybe the different kind of diet they should be using versus a
mm,
Mediterranean person. Maybe Mediterranean diet is better for them. So there are many biases how we interpret that data, and how the researchers are done. They usually focus on the diseases and they try to figure it out how many people survive this clinical trial, how side effects happen, and if there's an actual real value by approving this drug. But after that, there are many side effects patients suffer, but we find a reasonable number, and we say this drug probably will be safe for this population and starts prescribing it. And then along the way, patient come to us, they're having a dry cough from blood pressure medication or swelling in the legs. They cannot tolerate statins in the high dosages, muscle aches and pains are happening, or they are not even responsive to aspirin. They're still getting the heart attack, but you're still giving them the same drugs. Everyone right now today getting still
mm,
aspirin, beta blockers, ACE inhibitors, statins, Plavix, maybe Brilinta, and a bunch of other few cocktails. Everyone gets that after heart attack, and we know that every seventh or 10th person in the hospital today is not going to respond to statins. Or sorry, to
mm,
aspirin. They're not responded to aspirin. And we also know that many Asians, and if they get a high dose statins, will not like it. They will not respond high dosages. They will stop taking it. And we know that
mm,
many patients will not respond to ACE inhibitors as much. They get dry cough. So we understand
Mm.
now genetically we all are different. But imagine instead of taking guessing game just by the look of it, if I'm African American or I'm a South Asian, perhaps I should not take this kind of drug. If I'm a Chinese, perhaps I should not take a high dose statins. But how do you tell who's not responded to aspirin? Because every seventh and tenth person is not responder. So you have to start looking into genetic testing. You have to start understanding the drug we are taking are the right drugs we are giving them, and they have no side effect. There's a data, it's well published data, there's nothing, no new science there. But what the problems are, the science has been already established, but the delivery of scientific data or the guidelines have not been done yet. Why? Because it's hard to access data, hard to access these testings. Since we can't access the test, why then order it? Let's give the medication. I give you one practical example. If there is a free MRI available to you, but this MRI report will come back after 3 months, will you ever even take it? Will you ever even order the test if you're a doctor? Probably
Mm.
not. Even as a CT scan that is available, but the report will come back after 3 months, will you even order the test? You will not order the test. Same way genetic and genomic tests are right now today. Doctors don't have an access to the report on timely manner, so they don't order the test. Patient doesn't get an access to cutting edge technology. What do? They suffer through the disease and the side effect from the drugs. So as a pair, if we can cut this time period, as we have done for MRIs and a CT scan, start giving them clinical reports, genomic reports in real time, when it matters, when the patient is from the doctors, the doctor can take the right call at the right time. So pair saves the
Well,
money.
it's a wonderful vision. Just a question of how quickly we can get there. Let's talk AI and diagnostics. I'm guessing your average patient, there's just no use of AI in diagnostics. But how is BioAero using machine learning to, not just detect but prevent disease? What's your approach there?
Well, first approach in is a large amount of data, and humans are the biggest variable. If you're
Mm.
coming to see me early in the morning as a doctor, I probably am more alert. By the end of the day, if I have had a busy day, probably I'm rushing to my clinic and I'm very busy, perhaps missing out many data sets which I have not seen. So I'm going with the gut feeling, and probably I'm 50% right, 50% wrong
Mm.
to help
Wow.
diagnose a problem for you. So this is a present healthcare system because doctors do get tired. There are many variables that play a role. AI helps us in many different ways. We have built a next generation health record system. What it does, it reads our chart notes, it reads our lab systems, and puts data together. It's like having your junior medical resident who gathers all the information and helps us triage those patients so they can be seen earlier. Or perhaps there are other variables which a doctor is not able to look at it, so they can nudge and bring those analysis interpretation forward. They can summarize the notes and charts for us. Becomes much easier to document it, and also the dictation and transcribing is becoming more automated. So what does it? Doctor can spend more time talking to the patient and less becoming the receptionist or typist. So they can focus on clinical care. AI is like an and from a genomic perspective,
Hmm.
are you there?
Yes. Uh-huh.
If you're a podcast host or someone wanting to be interviewed on podcasts as a guest, visit podmatch.com. Podmatch automatically connects ideal podcast guests and hosts together for interviews. We always say it works just like a dating app, but instead of connecting you for dates, it connects you for podcast interviews. Podmatch has connected over 85,000 guests and hosts together for interviews that listeners love, all while saving you countless hours of administrative work through built-in automations. If you're ready to level up your podcast interviews on either side of the mic, start today by visiting podmatch.com.
Gotcha. Yep.
Hello?
Yes. Continue. Yep.
Hello?
I can hear you.
I think I've lost you. I cannot hear you.
Oh, I can hear you. So you can keep going. Can you hear me?
There was a call came in between. My wife's call came
Oh,
in between, and
okay.
even though it's do not disturb, but somehow she got through it. So I don't know how. So I cannot hear you at all.
Oh, okay.
I can see your
Um,
face moving, but I cannot hear you.
okay. Can you log back on, maybe?
Hi, can you hear me
Testing
now? I
one.
can hear you. No.
Yes, I can hear you. Yep. Testing 1, 2. Test, test, test.
Should I log in again?
Yeah, yeah. Log in
Oh,
again.
I can
Yeah.
hear you now. I can hear you now. I can
Okay.
hear you.
All right. The thought of
Apologize.
online. No worries. No worries. So um, let's shift the question a little bit to this idea of proactive care, predictive care versus reactive. So, how do you have to change your practice, the way you do medicine? What needs to change in medical education? That's quite a different approach.
Thank you for asking. It's an amazing question. Education needs to be changed. So far,
Mm,
Harrison Internal Medicine book has a very tiny chapter on genetics. There's no chapter on genomics, no chapter on multiomics. The science has
mm,
moved. We understand that there are certain mutations when we're born with it that define how we react to certain diseases. Sometimes we may have a mutation in our genome, but it's the whole environment around that genome or the gene that triggers a reaction. So in preventative medicine, what I practice, I look at the whole genome first. I look at the patient, making sure there is no high risk variants they inherited. Then I look at any other mutation they might have acquired along the way. Then I look at their gut microbiome data to see if they have any high risk pathogens in their gut, and if that pathogens could be linked to certain diseases such as IBD, IBS, cancers, and many different with different areas. And from there, I then step up next level called pharmacogenomics. So I look at genetically which drugs are good or bad for them. Along with when I use this base foundation of this data, then I have another layer of the data with a basic blood test we do. Either it's lipid panels, glucose panels, hemoglobin, etc. Then I have the ultrasounds, imaging together. So when I combine them together, I have much more data sets. I have imaging data. I have a biomarker data from the blood testing labs. I have genomic data. Based on that, I can make a more personalized program for the patient. If there's a high risk for prostate cancer, perhaps I should be paying more attention to their prostate, not just having a genetic recommendation for them. If there's a potential risk for colon cancer or certain syndromes, then they should be getting colonoscopy much earlier at much younger ages. Then I'll make a more personalized programs for them, not just based on the guidelines, but what matters to them. So using the information what we have, well-established evidence base, now adding the genomic layer and providing care based on that. So we need to rewrite our curriculum again. We need to rewrite our textbooks again. And all the disorders we have in Harrison book of internal medicine or any other medical book along the way, that genomics should be the basis as a foundation. And then you build the other layer of investigation we as the doctors do, then come up with a conclusion to decide how we can provide better care to the patient, and perhaps we can intercept the disease, and we truly can intercept the disease. I was speaking to some scientists in Italy a couple of days ago, and we're talking about how a diet can use as a transcription inhibiting system. So if you take the
mm,
right diet, you can literally inhibit the message of certain genes expressing. Already, Brazil has done a study on this area in young people with a high cholesterol. When the certain type of diet was given to them, they saw the impact of gene expression
mm.
in those young adults there. We have seen studies happening globally in this area. So definitely, diet plays a huge role. We need to incorporate that. We cannot just say do go talk to dietitian. We have to empower people. The dietitian should have an access to genomic data. They should have an access to AI tools, so they're able to personalize a nutrition plan. I call nutrition 3.0 or the healthcare 3.0. So first healthcare was imaging based, then healthcare became blood testing based. Now we have to add healthcare of genomic based. When you add all three layers together, now you have a full picture of the person.
Amazing. I'm looking at your website. You mentioned something called decentralized health as a trend you're watching. What does that mean exactly? And how are you enabling that?
Well, a lot of times the data is centralized in certain repositories. It's a patient's data, and many countries, including Canada, by law, is a patient owns the data, but is a repository. managed and owned by clinic or healthcare systems. And sometimes it becomes very difficult for patients to access their own data. So someone else is using their information, profiting from their information, and they have no say. So imagine if the patient have an access to their information, and not only just from one hospital, but from all the hospitals wherever they
Mm,
went around it, and so they could literally take a call when it matters to them. So if someone is accessing this information unauthorized, they would be alerted. And if someone wants to buy their data or the information, they can then profit directly from that. So this way will build trust, and the more bigger data repository will be created, and people will be more empowered. It becomes much
mm,
easier to enroll in a clinical trial, because many times the clinical trials uh, don't include visible minorities in many countries, don't include people from low socioeconomic status. They get missed out, and so even the clinical data coming out is biased. So what it does, it levels the field. Everyone becomes equal. So it doesn't matter you're rich or poor. If someone wants to enroll in a clinical trial, it becomes much easier for them to get enrolled. And from a
mm.
pharma company perspective, it's easier to find those patients.
Well, it's a great opportunity to leverage things like the blockchain as well for privacy and data protection. Um, so when it comes to healthcare in the U.S., as you know, health insurance is really a workplace benefit for many of us. If you're an employer, an enterprise watching or listening to this, um, can they work with you to make precision health a benefit for make their employees healthier and hopefully happier?
We'll be honored to help them, and we'll be happy to help them. Just give us a call if they have a problem, how to implement genomic based healthcare, how to move into healthcare 3.0. We'll
Mm,
guide them, hold their hand. If they need technologies, either AI based panomic technology for real time analysis of large amount of data, or if they need help in upgrading their lab infrastructure, we'll be happy to share knowledge with them. If they need any help with the delivering of healthcare based on the new technologies, we'll be happy to guide them along the way. And if they truly want to protect the data, especially for the future quantum threats coming in play, with lots of cybersecurity breaches are happening, and they want to add on blockchain-based data security layer. We do have in-house team. We'll be happy to provide them how they can start backing data in multiple clouds with a blockchain encryption. So this way, the data is private, protected, and people feel safe.
Wonderful. Yeah, so many ethical considerations. We saw the meltdown of 23andMe and what that meant for people's genomic data, including myself. It's out there. God knows what's going to happen. So, as a health tech company in Canada, a beautiful part of Canada, by the way, how do you take this mission and vision globally? How do you scale, not just in North America, but internationally? Is it just money, or do you need something more?
Well, thank you for asking this question. For any startup, the vision is one thing, and the technology is the other thing. And the last thing that matters is meeting the right people,
Mm,
more than any money or any funding we can
mm,
raise. Yes, money does play a role because you need to hire the right talent who can help us
mm.
grow. But meeting the right people matters most than anything else. So I like to travel. I am traveling globally and finding uh, people who are converted in this area already. They believe in this area, they're practicing medicine. So they are the early adopters. So I like to meet with them, understand their challenges and their successes, and perhaps I can replicate those successes globally. So I spend some time learn with them. So I reach out to various hospitals, institutions, ask them if they're looking for these kind of solutions, and we are open to collaborations, joint ventures, and we signed MOU in Saudi company in
Mm.
Boston last week. We do have a huge interest in UAE, Europe, UK, USA. So we are looking to grow globally. We want to be in every country because the problem is universal. We are 8 billion
Mm.
plus people on this earth, and all of us should be getting healthcare delivered through genomics and multi-omics way. And we can do that today. So I would like to work with anyone and uh, who can help us open those doors. and want to talk about their own personal research project or the personal struggles they're having at home, and they're not getting the right answer from the doctors, I would ask them to reach out to BioAero. We'll be happy to, if you don't have an answer, we'll work with them to find that answer.
Oh, incredible. What a great opportunity to collaborate. And what's your sort of vision for, 3 to 5 years? What sort of opportunities we'll be looking at then for health monitoring, I guess digital twins? Gosh, know what kind of AI models we'll have. And it's a very exciting time.
Well, what I'm envisioning is that there will be countries whose healthcare will be delivered through genomics, and
Mhm.
that'll be happening in Saudi Arabia, UK, some other parts of Europe. They are going ahead. UK already announced that every newborn will be getting a whole genome sequencing.
Wow.
As a 10-year program, being the first developed country to implement that. Saudi Arabia is implementing genomics for everyone.
Wow.
Emiratis have done a whole genome sequencing for themselves. Qataris, Bahrainis, Kuwaitis, they all are coming on board. Chinese are also ahead of it. It's just a matter of time. So I will see Americans coming on board. So is Canadians and other part of Europe joining hands when they start to see value coming out of NHS in many different parts of the world. And in 3 to 5 years, I do see that healthcare will be shifting more towards data focus, and AI-based healthcare delivery will be more using wearable data coming to doctor offices, integrated. We'll be looking at environmental data, the type of air we are breathing in, the type of water we are drinking, or the food we are eating. We'll have more awareness about that. The AI agents will play a role. So we'll be having more interaction with them. People will be learning more about their health and body, understanding what the ingredients are going inside the packaging, what they actually mean. And AI
Mm.
agents will be guiding them and advising them these foods are good or bad. So the healthcare will be totally different, and there will be smart devices. Over the next 5 to 10 years, what I see that healthcare will be delivered from homes. There'll be less reliance on hospitals, less reliance on coming to the clinical side. It'll be more home care will be delivered wherever the patients are. So healthcare will be available 24 hours. And blood testing will be easily available. Less requirement for going to lab for the blood testing, for the basic blood test, or the cardiac blood test biomarkers. So huge disruption is coming. And the need for a big brick and mortar hospital or clinic will go down. It'll be just based on acute care or the procedures that cannot be done in homes. Those will be done in those clinics and hospitals, but most things will be delivered in people's home.
Incredible. What if I'm an individual or a family listening? Can I go to BioAero and get my genome sequence as well and access your services directly from the website?
Yes, please. Anyone can go to the
Oh,
website and they can access gut microbiome, skin, oral, vaginal. They can get access to epigenetic testings, and many more tests are going to be available soon. And one thing I want to mention to your listeners that we don't sell people data,
mm.
and we respect your privacy, and we do have a strong standards to protect your privacy, and we are not into data selling business. We are in healthcare. Our goal and mission is to make sure you get the best healthcare service possible.
Well, wonderful. I can't wait to try it myself and many family members interested. Please look us up when you're next in Boston. And thanks for joining. Appreciate your time and the amazing enthusiasm you're sharing here.
No, thank you so much for having me. Really appreciate that.
And thanks everyone for listening, watching, sharing this episode. And also check out our Tech Impact and AI Impact TV show now on Fox Business and Bloomberg. Take care, everyone.